Fitchburg is a medium-sized city here in central Massachusetts. About 40,000 people call it home. It's not that old, it's not that new, but still, we have quite a history. The land here, the river here, the people who live here, is what makes Fitchburg what it is. These things have changed over the years, and that's affected what we have become now. There's questions we can ask about why Fitchburg is what it is today. Why aren't we more agricultural? Or why don't we have a stronger retail economy like surrounding communities do? Over the course of this series, we'll be taking a look at Fitchburg and what has made it what it is. We'll be peeking in a few corners and looking in a few doors to find out what has made us the community we are today. Healthcare is a major concern and expense for everyone today. Since the beginning of time, people have been sick and have been injured and have sought medical care. Fitchburg shows how the process of medical care and the standards of medical care have changed over the centuries. The number one killer today is heart disease, followed by cancer and stroke. In 1901 and 1922, the number one killer was heart disease, but the second two were pneumonia and tuberculosis, both contagious diseases. The 1850 U.S. Census gives us some interesting information. That was the year that they recorded the death of every individual, how old they were, what they died from, who their parents were, where they lived. The list of diseases is familiar and unfamiliar. Dysentery, dropsy, scarlet fever, consumption, which was later called tuberculosis, smallpox, scrofula, which was a form of tuberculosis on the skin, typhoid, whooping cough. All of those were diseases that were contagious, that could be spread by food or through germs. Then other diseases and other conditions killed people. So there was a wide variety of causes of death. How were these people taken care of in our history before there was a hospital? Until the advent of antibiotics, isolation and quarantine was the only way to stop spread of disease. In 1775, a doctor named Thomas McCarthy, or perhaps Thaddeus McCarty, came to Fitchburg and was given permission to set up a smallpox hospital where he performed an early form of inoculation. This hospital was located near Westminster. We don't know the exact location now, but it was well away from the center of population. Later, in 1872, another pest house was set up at the Thurston Home on Flat Rock Road, where smallpox victims were sent to recover or die. One of the deadliest epidemics to come through the area was the Spanish flu. It was also called La Grippe. It came to this area probably from Camp Devens, where servicemen brought it home with them from Europe. At the time, there was less than 40,000 people living in Fitchburg. 4,232 people developed this disease. 264 were killed, most over the course of 3 months. It was too much for the medical establishment to deal with. Two homes on View Street were opened as clinics. Patients were jammed into the front rooms of the buildings. Tents were set up on the lawn outside. In one home, a young pregnant woman was surprised when a naked man jumped out the window in front of her. Later, Eleanor Roosevelt went to that home when she visited Fitchburg. Another home was opened on Main Street with 25 cots for children. The hospital was closed. The people who went to the infirmaries were the ones who could not be taken care of at home, mostly lodgers in other people's homes who had no family. The conditions that people lived and worked in were very different in 1918 than they were today. They lived in densely populated areas of triple-deckers. Some of them did not have hot water in their homes. We made some real progress in germ control at that point, though. At one point, the health department thought perhaps it would be a good idea not to have common drinking cups and towels in the workplace. By the end of the 1800s, people began to know that they needed to have a hospital. An advertisement in the Fitchburg Sentinel offered a hospital on Pritchard Street. It had the best of nursing. It had first-class nurses. It would treat chronic diseases. They gave a discount for the first week. In fact, 1 week's treatment free and board, if necessary, to any treatment taking place during the present year. This hospital also specialized in treating less deadly conditions. They could remove moles, birthmarks, red veins, freckles, moth patches, and facial blemishes. And then, of course, they'd be happy to take care of your tapeworm. In 1894, a hospital was opened off Mechanic Street in Fitchburg. The money came from Sarah and Gardner Burbank. Land was purchased, and a home was used to house patients. Student nurses served as much of the labor. They cooked, they cleaned, they lived where they could, sometimes just in the hallways of the building. People were happy with their cleaning capabilities, but the food left something to be desired. Fanny Farmer was hired to come and do a special course in cooking for the nurses. The hospital was supported by donations from private people and by city appropriations. Some patients could not pay, and they were taken care of. Over the course of the next few decades, more buildings were opened at the hospital campus. A building with open wards for men and women, a TB building so that the TB patients could be isolated from the others. An interesting note in this is that Burbank earned part of its income from the farm and from selling woodlot. Their cows were among the first to have TB tests in the area. As time progressed, private rooms were built. The Lucy Helen Hospital was opened on Main Street for maternity. Working conditions improved for the nurses. Instead of 24-hour shifts, eventually they went down to a 40-hour week. Private duty nurses served in the hospital and in people's homes to take care of them. Another hospital opened in Fitchburg from 1940 to 1963. The building is still there, 76 Summer Street, and has many medical office buildings in it. In 1942, trustee Richard Bullock noted that they started to sterilize the infants' bedding, and the infants stopped getting impetigo, which was an extremely contagious skin disease. The financial picture at the hospital continued to evolve. City appropriations ended in 1967. Insurance payments were starting to become more common, covering more of the expenses. Nurses continued to demand better working conditions. In 1982, they went on strike for over 170 days. Their wages were raised to $8.14 an hour for a nurse in her first year. The minimum wage at this time was $3.35. Gradually, the campus began to supply more than acute medical care. A birthing center was opened in 1980. The Highlands, a nursing home, was opened in the 80s after the nursing school closed. The building had been used as a nursing school. The TB clinic was turned into a daycare center. A chest clinic remains on the campus. In 1993, the hospital merged with Leominster, forming Health Alliance. Inpatient care was ended. In 2011, the psych unit closed. Now, they are building a new Community Health Connections building to serve another population. Specialized care and a health clinic remain readily available up the hill, but inpatient hospital needs must be met elsewhere. Welcome to the live section of our broadcast. I'm very happy to have several wonderful guests here tonight. We have A.J. Juarez, who is from the Massachusetts Public Health Association. He's a community organizer for Western Massachusetts. We have Ann Yeagle, who is from the Massachusetts Opportunity Council. She is the nutrition manager and is also in charge of a program called Fun in Fitchburg. Did I say that well?
Perfect.
Oh, thank you. And we have two student spokespeople here with her today, Marcos Rivera and Bria Pichette. and we'll all be speaking with you during the course of today. We're going to talk about where we are at now with healthcare, specifically what our needs are and how they're being met. And with this group of people that I have here today, they're very interested in being proactive in meeting healthcare needs rather than just getting sick and going to the hospital. I'd like to also remind everybody before we get going that you are more than welcome to call in with questions. We need your questions. We'd like to know what you want to know about. The number at the station here is 978-343-3130, or you can even send me an email at fitchburghistory@gmail.com, and we will answer your question if we possibly can. I'm going to ask people to introduce themselves. We'll start with AJ.
Hi, folks. I'm AJ Juarez. I'm from the Massachusetts Public Health Association in our staff, Western Mass, and we are an organization that works on legislative solutions to public health and prevention problems. And we're an old organization. Seeing that little piece we just saw, we date back to the late 1800s, so we've been around a couple of blocks. So it's good to have perspective. I'm glad to be here, Ann. Thank you for inviting me.
Thanks, Ann. AJ.
Hi, my name's Ann Yeagle. Like Ann said, I'm the nutrition manager at the Montechusett Opportunity Council, and I was talking to AJ before, and I said my real hat is to run the senior nutrition program, the elderly nutrition program, and we do Meals on Wheels, but also I am a dietitian, so healthy eating is near and dear to my heart. So we had started a workplace wellness campaign known as Fun in Fitchburg, and it's gone into the community, and I've gotten more and more involved in that. So as part of that, I now also work with our Fun in Fitchburg program too, and that's how I'm involved with Marcos and Bria, so maybe they can talk about themselves a little bit.
Please do tell us where you go to school and what grade you're in and how you got involved with this program.
Well, I'm Marcos Rivera, and I go to Leominster High. I'm 16 years old, sophomore, and I'm a peer leader at Mock. And how I got involved is I was curious on what was going on around my neighborhood and how life is exactly and how you deal with it. And I looked up on our website, and I found out that we can search and figure out how to do this stuff.
Excellent. Thank you.
And I'm Bria Pichette, and I'm 16, and I go to Fitchburg High. I'm a junior, and I'm also a peer educator for Mock, and I got involved because my family is involved with Mock, so through hearing, I wanted to get involved, and yep, that's about it.
Great. And maybe you could give us a little overview of what the program is, and then we can tie Andre's part in also, because he's more of the state legislation that would support a program such as this. So why do we need this, and what is it doing to help?
Sure. Well, like I said, it started with our workplace wellness program, and really looking at, instead of one particular program, looking at our environment. Because as you saw in the clip that you just showed, there used to be acute conditions that could be resolved immediately. But the chronic conditions, last for a lifetime typically, and they develop over a lifetime. And what's happened in our environment is our environment now fosters people becoming overweight and obese. And what's happened is, this has occurred, is, we used to, for instance, drive or walk to the store, or we used to have to actually open our garage doors, or we used to have to actually walk to the post office or get our mail, or all little things that add up throughout the day. And the same with healthy eating. We used to eat wholesome meals. There weren't all fast food restaurants lined down the street. We didn't just drive through in a car. So when you saw that with the acute health conditions, this wasn't a problem with the environment, and overweight and obesity wasn't a problem back then. So Fitchburg has an especially high incidence of overweight and obesity because it's oftentimes related to health disparities, particularly income, socioeconomic status. And Fitchburg does have a high poverty rate in it. So we have lots of things in this community that foster being overweight and are barriers to be able to access healthy opportunities. And as the Community Action Agency working with families and individuals all the time, we realize this. So we wanted to take workplace wellness into the community and make the community healthier instead of just our employees too. So I think Marcos and Bria wanted to read some statistics about Fitchburg so you could see what's really going on.
Excellent.
Yeah, Fitchburg, Massachusetts has an increased risk for obesity and subsequent chronic conditions compared to state averages, given the radical diversity, socioeconomic status, and higher than average crime rates of the community. 17% of the city is comprised of Hispanics or Latinos, and 15% of people in Fitchburg live in poverty. And for obesity trends, more than 23 million children and youth in the United States are obese or overweight. Researchers estimate that 16.3% of children and youth ages 2 to 19 obese, and 31.9% are obese or overweight. The obesity epidemic has been on the rise for decades and has now reached epidemic proportions. The obesity rate among children ages 2 to 5 has more than doubled from 5% to 12.4% during the past 3 decades. The obesity rate for children ages 6 to 11 has more than quadrupled from 4.2% to 17%, and more than tripled for youth ages 12 to 19. Oh yeah, wait. That's fine?
Yep.
Okay.
And then Bria has just 2 last things she wants to say.
Great.
In the state of Massachusetts, childhood obesity aged 10 to 17 ranked 30 out of 51 states at 30% obesity and continues to increase. Per the Massachusetts Department of Public Health, the most recent BMI statistics collected for children in grades 1, 4, 7, and 10 across the state rank Fitchburg as having the second highest prevalence of overweight and obesity in the state.
Thank you for summing that up for us. Now, this is a program that relies on grants and other fundings to run. Andre is active works for an association that, how should we put this, tries to get legislation that will support wellness programs. Can you elaborate?
Absolutely. As I said, we're one of the oldest public health associations in the country, and we have a history of working on legislative and common sense solutions to public health problems. And the obesity rates, the climbing obesity rates among children is most definitely a public health problem. You can frame it around what I call common sense scenarios. For example, I have 3 boys. I am a father of 3, and the stats tell us that 1 in 3 children born in the year 2000, the year that my children were born, will develop adult onset diabetes by the time they're 20, and will have a shorter lifespan than their parents.
I think that's the most impactful piece.
Absolutely. So frame it in a common sense way where folk can understand it. It drives the point home that clearly we need to be proactive and preventive about these issues. So Massachusetts historically led the way, but given our budget crisis and our budget constraints, we are really facing some challenges. For example, the funding that funds Fund and Fit in Fitchburg, the Mass in Motion funding, is the state portion of that it's actually a very neat thing in that it's funded by a private-public partnership. But the public side, the state side, is in jeopardy. It's not in the governor's budget, and therefore we don't know, looking forward, how this is going to play out.
Okay, the governor's budget is not the final budget for this year, so there's room for change.
Correct. There's room for change. So if you want more information, the person leading that campaign for us is Maddie Ribble, and he can be reached at 617-524-6696. And yeah, this is, we don't want to go into a huge civics lessons, but basically what happens, the governor files House 1, that's his budget, then the House and the Senate respond, and the Senate and the House, through compromise, through a process called committee, work out a budget that comes out of the legislation, and then the governor can veto or approve it. So we're early in the process, but it's telling that, and without vilifying anybody, it's telling that the shifting priorities during our budget crisis do impact us on a daily basis. So that folks like Marcos and Bria may not have access to these programs given the conditions. So MPHA is working on this thing called the Act Fresh campaign that looks to be proactive around these issues.
Okay, the Act Fresh campaign.
Correct.
And that's looking for legislation, specifically for what?
Well, there's 4 components, and we vetted the campaign throughout the state with different sectors and different folk. Different stakeholders is the common term. But it looks at 3 things. One is to look at land use and land reform through zoning process. How does it impact? Can we make it easier for community gardens to happen? Can we make it easier for zoning issues that increase healthy activities as part of the process?
So this land part and land use and outside is an important part of the legislation you're looking at.
Correct.
Okay. I believe that your program has focused in on that.
Definitely,
And we
and-
have some graphics to go with that. Okay.
And I can talk a little bit about
Okay,
that.
excellent.
So part of what we're doing is we've really focused on 2 strategies.
They'll show up there.
Okay.
Okay.
We've really focused on 2 strategies out of our assessment that we've done. One is around healthy eating, increasing consumption of fresh produce. The other is increasing usage of our parks in Fitchburg. In terms of the increasing consumption of fresh produce, one thing in particular, we've put in 21 community gardens in Green Acres and the Meadowbrook area, and also we're working to increase access to our farmers market in Fitchburg. One of the things we found through focus groups is a lot of people aren't aware that there are Fitchburg farmers markets right now, and then making sure that they're affordable and that everyone can access the fresh fruits and vegetables at these markets. And lastly, the other piece of the fresh produce is working with the corner stores and restaurants and making sure that there is healthy fresh fruits and vegetables in our neighborhoods where we're working.
Great. And did we get pictures of the community gardens up?
We do. We have
Yeah.
some pictures of the community gardens up there. You can see those, I believe, were in the Meadowbrook Village.
Okay.
So the youth and a lot of our partners helped to build those community gardens. And our partnership is a really big part of Fun in Fitchburg. We have over 50 people involved in the community helping us from the private sector and the public sector. You can see our youth peer leaders are an example, but also we have policymakers sitting at the table. So we have the commissioner of the Parks Board. We have the Parks Director. We have the Farmers Market Manager. I don't need to list everybody, but we have people in the school system. So all those players are really important to get them at the same table. So we really know, what the barriers are, and then overcoming the barriers based on what our residents say.
Now, one thing that we talked a little bit about before, Andre, was all of these are new things that are happening now. We also have the new healthcare initiative that's happened in Massachusetts. Has there been any way to measure the success of any programs like this?
Well, it's early in the game, and there's some synergy here. I think that we need to speak to this because Ann mentioned a couple of things that are in play. Another plank of the Act Fresh campaign, for example, covers corner stores, looks at incentivizing the purchasing of appropriate equipment and to improve on the access to healthy foods and really use the buying power that is often present in corner stores or bodegas as part of the solution as opposed to part of the problem. So that's another plank. Another plank within our campaign is to look at the implementation of the school nutrition bill, which has language that, for example, makes it easier for direct purchases from school systems to farmers, to producers. And so there's some synergy building here, and it connects to your question, because part of what is at stake is the preventive measures within healthcare reform. So as we move forward, it is a bit early as to whether we have been effective in changing that. You know, some of us have to say to our kids, do as I say versus do as I have. I speak obviously from personal experience. But the underlying factor here is that no matter where we are on the spectrum, it's about moving forward. It's about living a healthier life. It's about improving just that little bit so that we can prevent some of this chronic condition. So as we look into the Healthcare Reform Act, Massachusetts has done well in making it almost universally accessible. The jury's still out in terms of how about quality of care and quality of access, and there's quite the governor has an excellent proposal about looking at payment reform. Right now, the way that we pay for medical care is not preventive. We pay for the number of procedures. So if a doctor is running high volume on lab test A or X-rays B, they're likely to make more money. We want to turn that card and speak to wellness. The longer you keep folk from developing a chronic condition, the more you'll be able to retain in payment. And the details, I don't want to speak in details now, because the jury's still out, language is still being developed, but the concept of rewarding wellness rather than rewarding procedures is what's at stake. And the details are a long way from being clear, at least in my mind. But that's the juncture, if you may, between prevention and healthcare delivery.
And then the other thing is, I just wanted to add to that, just the shift from the individual level to the community level. So instead of looking at our healthcare model as going in and just helping an individual, having community supports there, like we're trying to do in our communities across the state and across the country, to make it easier for people to choose the healthy option.
Excellent. Really quickly, because we're almost at the end, you two participated in this program. Have you made any concrete changes in your life, or has your families made any concrete changes as a result?
Yes, actually, we changed the way how we eat and how we go out and have fun and actually lose weight or gain weight in a certain way. And we play sports, my family.
Let's give Bria a chance to.
Yeah.
Yeah, I've started going to the gym, and we've cut the fast food out and just trying to make it healthier.
Excellent, excellent. Thank you all so much for coming, and thank you to all the volunteers who've helped out tonight, and to Robin Heiser, who put together the first part of this program for us. And special thanks to the members of the Friday Nights in Fitchburg History Club, which meet once a month at McKay, for sharing many of their memories with us. Our next article on Sunday, April 10 in the Fitchburg Sentinel and Enterprise will be on culture, and our Monday night show on the 11th will also be. We'll be talking about music, art, dance, and theater. So please tune in.
TV is killing me. TV is killing me. And you can bury my whole body down in the deep blue sea. Too late. When I was on my feet, I could not walk down the street, for you men looking me up and down, my head to my feet. But now, TV, killing me. You can bet